Sorry I'm late, guys. I got held up in another meeting.
Okay, well, welcome to Grand Rounds, everyone. We'll be discussing discharges for patients in room 223, 224, 226, and 236, all from the rehab floor. So let's get started with patient in room 223.
Okay. Well, let's talk a little bit about the history of the patient. Vince McCall was admitted here mid-morning on July 20th, 2011. He is 37-year-old male. He is 6 foot and 195 pounds. Vince works as a computer programmer. He had suffered from a hemiplegic stroke on the left side of his brain, affecting the right side of his body. He had immediate cranial surgery performed by Dr. Lewis, and he has been here roughly about 9 weeks, which all of you basically know because we all work with him.
I've been seeing Vince for twice a week to check up on his progress. I've decreased all of the dosages of his medications. He's made steady progress and has stated that he's very anxious to return home to continue his rehab in his natural setting. His family has also been very involved throughout his hospital stay.
Vince's vitals have been stable at rest and during minimal activity. He has to decrease in the amount of his pain medications, like you said, and he's taking them once in the morning and once before bed, and he is fully aware of when and how to take his medications. Within the last 3 weeks, he has shown a decrease in the usage of his call valve and is showing improvements with going to the bathroom alone when needed, and he's also improving with the ability to feed himself.
Okay. Now can we hear a little bit from the therapy since we heard from the doctors and the nurse?
Sure. When Vince first arrived at the hospital, he was unable to feed, dress, ambulate, and perform daily hygiene tasks. So I've been doing therapy with him for about an hour a day for the past 8 weeks after he was transferred from the ICU. We have been working on functional tasks to help get him back to his ADLs, such as putting on a shirt. However, the patient still struggles with the task of buttoning, so we've been using adaptive devices for him. Patient is also unable to tie his shoes. However, he has adapted to slip-on shoes that he is able to don and doff with a long-handled shoe horn. He has improved in his feeding and brushing of teeth and other tasks related to using his right hand towards his head and face. He was only using his left hand for approximately 5 weeks and has been showing great improvements with his right hand, as we have been using a mitten on the left so that he is forced to use his right hand.
I've also been working with Vince, doing some range of motion, strengthening, and improving gait technique. Vince initially started with a 4-point walker with max assist of 1. He has progressed into a hemi walker and is more recently into a 4-point cane with contact guard. He was able to ambulate originally 25 feet with taking lots of breaks, but he's increased his endurance and now he's able to ambulate 500 feet without having to stop for a break. He's also been ambulating up and down the stairs, roughly 15 steps, using 1 step at a time method. His strength has improved from a 2 negative out of 5 to a 4 out of 5 on the strength on the right side compared to the 5 out of 5 on the left.
And as far as his speech goes, anytime that I've worked with him, he's been really good about being alert and oriented to all person, place, time of day. Anything that I've asked him, he seems to be able to tell me exactly what's going on with his treatments. He still struggles with formulating words in a timely manner, though, but he does get it out eventually. Vince was able to only use about 1-syllable words when I first started working with him, which now he's creating full sentences. They're small, but full sentences. We have worked with communicating through writing, which has been difficult since he was primarily right-handed, and now he's having to write with his left hand. But Vince initially was only drinking thickened water diet due to his risk for aspiration, but now he's able to control his swallowing through some of our techniques that we've used through therapy, and he is able to now drink regular liquids and eat some soft foods. Vince also has been enjoying music that is playing a huge role in his therapy, which is helping him with rhythms and patterning, which is also helping create more full sentences.
As the speech therapist said, he's now no longer on the thick liquid diet, he's on the soft foods. So some foods he should be encouraged to eat would be fish, which are high in omega-3s, your mashed potatoes, yogurt, bananas, scrambled eggs, and pudding. He should also eat fruits and vegetables, which can prevent the hypertension. His food should be kept at like room temperature because cold and warm will initiate coughing, which we don't want to have. Limit his salt intake to 2,300 milligrams a day and avoid fried foods, fatty meats, butter and margarine, and whole milks. He should probably choose more than lean milk meats, and I have no concern with him eating at home.
I just have a question for her really fast. Have you talked with the family about it? Like, are they aware of all his eating habits?
Yes, the family's well aware of the food need to start off soft, and then you can progress him once he's able to swallow correctly and be able to maintain that. And he's going to have to, like, they want to progress him to eating some nuts and stuff because that'll help with his normal food intake.
And I also talked with the family. They're a big, strong support system. He has his wife, 2 kids. They are younger kids, but he has 2 kids. And then his parents said that they would help out with the kids also helping with him. He also, we're trying to get him into a home and outpatient therapy. We're probably going to take him to a home therapy first to work with him and get him moving around. We need to schedule a visit with the PTs and OTs to make sure that Mr. McCall's home is appropriate with his living environment, to make sure he has shower seats, if he has any sort of, needs a lift to get in, anything like that. We can meet up next week to finalize his discharge, but other than that, we just need to get into the home and work with his home and his family to make sure that they're aware of everything and how they can help him at home.
Okay. Does anyone have anything additional to add about Vince before we move on to the next patient?
I think we got it all.
Okay. So let's move on to room 224.
All right.